Hi, welcome to Healthy Living. I'm Dr. Don Pelto, and today I have Dr. Chris Bromley here. We are interviewing, and we're going to talk about it's toenail season and laser season. Chris, thanks for joining us.
It's my pleasure. Thank you for the invite.
So, Chris, let's talk a little bit about the problems with fungal toenails that a lot of our patients have, and yours specifically as a podiatrist. Traditionally, before you had laser, how have you been treating toenail fungus?
Well, I tell patients all the time that there are a number of treatments for toenail fungus. The most popular treatment of all is the ignoring it, hoping it's going to go away method, which everybody tries. Then there's the topical medications, which we've had in our profession for many years. For a number of years, we used the Lamisil by mouth, the oral medication, but there are a number of risk factors and side effects. So most of my patients, because I have a very holistic regenerative practice, are looking for something that's non-drug, very safe, and doesn't have any side effects. So our go-to treatment since 2017 has been able to introduce the patients and get them enrolled in our Lunula program. And that's the use of the low-level laser, which is FDA approved for onychomycosis and has been very effective in the literature and been super effective in my practice.
That's great. And before the Lunula, or since laser existed, is this the first laser you've had, or have you had previous ones or previous things you've tried being a regenerative practice?
No, when lasers came out, we had the Cutera. I did a study with another laser company who was using a different wavelength. So I did about a 2-year long-term study for them, looking to see whether or not their laser was effective. I've had a long-standing relationship with Zirconia, but I have, because I do a lot of teaching, I always try to get as much laser experience as I can. And I really liked the Lunula because it was the first really sort of hands-off treatment. It didn't require me to sit there with a laser and do every single toenail, which is not the best use of my time. And the patients liked the outcome and the easiness of the visit.
Yeah. And so the old laser was like a Cutera. You had to go toenail by toenail, and now you can do five toes at a time. Do you do the typical 4 treatments? Is that what you do, or how many treatments do you do with the Lunula?
Well, the original protocol, and it was in the Dr. Zhang study, was 4 treatments, 1 a week for 4 weeks. What I found in my practice was I really wanted to do a little bit more. So our protocol is 4 treatments, 4 weeks in a row. And then we do a follow-up visit at 6 weeks where we'll debride the nail down, removing the part of the nail that was cleared up by the Lunula. We'll do another treatment, which would be the 5th. 6 weeks out, we go ahead and debride the nails again. That would be trimming the nail length for those people who don't do a lot of this. And then we also file the top of the nail so that we can reduce the thickness. And then at that visit, we do that 6th treatment. So we do a total of 6 treatments over that period of time. And then we watch the nail grow out. Very important to set expectations up, making sure that patients know that their toenails grow very slow, that it's typically going to take anywhere from 8 to 12 months for that nail, if it's fully involved, to grow out, so that they know what to expect through the treatment.
Are there certain nails that are a better candidate for laser, or do you do any nail?
No, I think that's a great question. If you've had nails that are fully involved, that is the entire portion of the nail, all the way back, from the tip of the toe all the way back to the nail, very, very thick, been that way for many years. Those are going to be tougher patients to get the outcome. You just have to reassure them that we can improve the appearance of the nail. We can eradicate the fungus, but you're not going to have toenails that are pink and clear and thin the way they were when you were 12 years old. Not possible, because the nail bed and the nail root has been damaged by that chronic fungal infection. It will eradicate and improve, but it's never going to be a pristine, perfect looking nail when they've been that involved for that long.
Do you think taking a nail sample or a biopsy is important prior to starting therapy or after to verify?
I do. In fact, we do a number of things here. One is on that visit, that consult, we do take a nail specimen and we send it away, and you'll be surprised what grows out. I mean, I've expected typical nail infection is, T. rubrum or T. mentag. I've had those come back as being some really weird molds things that I didn't expect. So we always take a baseline nail specimen. We take pictures before, at the end of the 4-week, at the which will be the 4th treatment. We take pictures at the 5th and 6th treatment, and we have those in the computer to show to patients, their progress, because people will forget what they look like at the beginning. So it's a nice reference for our physicians, because there are 4 of us in the office. We typically try to keep our own patients to ourselves, but if we're seeing somebody else's patient, to be able to have a visual reference of what that nail looked like at the beginning of the treatment is very important.
Okay. And I think we talked a little bit about this. How often do patients opt for laser versus other treatments? Are there certain patients that like more topical? Are there certain ones that like the oral medication, or do most of them do the laser in your hands?
Well, then another great question. Most patients who've had onychomycosis that are, sort of attentive to their hygiene, particularly women, they will have tried some topical before they even get to our office. Men, not so much, but women have always tried something topical. So when we discuss those 3 treatment modalities, ignoring it, hoping it's going to go away, the topicals, the oral. Oh, by the way, we also have Lunula. Here's a little video that you can watch about how it works. There's a handout. Most patients typically will opt for the Lunula. We also offer a little bit of a special incentive. If somebody is out 12 months and they're not pleased with the way the nail looks, and we take a specimen and they've done everything I've asked them to do, I'll repeat the treatment for them if they're not pleased. So it's a nice way of sort of standing behind our recommendation, and I've really been very, very pleased with the outcomes, as have the patients.
I'm sure there's a lot more confidence then if you take a nail sample after 12 months and there's still fungus in there, then you'll retreat your process. That's
yeah. No, I had a patient who insisted that it didn't work, that she wasn't really happy with the way, and I did tell her that this nail, it was one toenail that she had been stepped on by a horse. It was a very thick deformity. We took the specimen, we showed her what the growth was, and at the end of her 12 months, she really wasn't that happy. And I said, well, let's take a look we'll take another specimen, and we compare, and it came back negative. And I think I did it twice just to convince her, but we did retreat her, because ultimately we want patients to be satisfied. We want them to have the outcome they're looking for, because that's really the best statement and the best marketing for us to see more patients.
Yeah, certainly. And do you ever have to do, for example, on that thickened toenail, do you ever do a combination of maybe your topical urea nail gel or anything else like that to help bring down the bulk, or even a topical or an oral at the same time? I know some doctors do that.
Yeah, I have patients, because my practice is pretty holistic. I live right near Vassar College. This is a very sort of vegetarian, vegan friendly neighborhood. I mean, patients tend to really be interested in the holistic aspect and what they can do. So if I mention something like that, they may try it, but I like to mechanically, I don't want to spend a lot of time, obviously, but we put a mask on. We have the appropriate file. We put a mask on the patient. We can file that nail down and do a good job if it's really thick. And we do that before we start. If we have somebody who has a very thick toenail, we call that onychogryphosis. We want to go ahead and reduce the thickness of that, because it'll make the laser more, able to penetrate the nail tissue better.
That's great. That's great. And so let's say people want to schedule this therapy. We'll let them share about your practice, where you're at, and how they can learn more information. What's your website and things like that?
Well, we're in Poughkeepsie, New York, which is an hour north of New York City. We're right where IBM started. It's a nice area right on the Hudson. They can go to Premier Medical HV, which stands for HudsonValley.com. So PremierMedicalHV.com. They can go to the website. They can information about the doctors and the different treatment modalities that we have, and they can send us an email and make arrangements. The Lunula laser is actually the 5th doctor in my practice. It has its own schedule, and the patients are coming in during the day. They have an appointment with a Lunula. The MAs get them set up. We do check in on them, and then they complete that course. And then, as I said, I'll see them at that 5th and 6th treatment, and then we do follow up.
Yeah, and that's great. And if they're not in New York, they can go probably to lunula.com and find the providers that provide. If you're in the Worcester area, might be watching this, we do that at our office as well. Talking about laser and kind of regenerative, if you don't mind, do you use laser for any other types of podiatry care?
I do, actually. I have about an 18-year experience with Erconia. I've used lots of different lasers. The FX35, which is their musculoskeletal laser, is approved for plantar fasciitis. So we've been using it as part of our plantar fascia protocol for about 10 years now. The FX35 is a portable, again, low-level laser that we use to stimulate the healing of the plantar fascia. We know that the fascia typically breaks down. It doesn't have good blood flow. As we get older, we don't have as much collagen. Therefore, the weak points of our body, rotator cuff, knee, heel, are going to break down. So we use the FX35 to reduce the patient's inflammation, stimulate healing, and it's part of our protocol, which is, home-based stretching, no barefoot, orthotics, good shoe. And then we use the Lunula in the office as an alternative to oral medication, like an anti-inflammatory or non-steroidal anti-inflammatory. We're using the Lunula when they come in weekly as part of that protocol. We may be using it in conjunction with K-tape if it's not 90 degrees and humid. If it's the time of year, we may be using a plantar fascial sleeve or brace. But the FX35 is part of that Erconia line. It's a big part of our practice. We also use it for some other musculoskeletal conditions, and it's part of our post-op protocol as well. So when patients come in for their post-op visits, we use the post-op codes, and we do that as well.
That's neat. I think one thing we should touch on, just going back to the fungal nails one more time, in terms of preventing recurrence. And so you say you do 4 visits, then 6 weeks, then 6 weeks. So that gets you about 20 weeks there. Do you see them after that? And then how do you prevent any recurrence? Any thoughts, any topicals, any shoe sterilizers, things like that?
So as we said at the top of the conversation, we always start with the tea tree body scrub that you can buy online. Very popular website people go to all the time that deliver every day. And then we also encourage them to get the shoe sterilizer so that they're starting to do that, and we make that part of their routine. And then we do follow up at the end of that 6th treatment, and then we follow up at the 12-month mark to evaluate them. And then what we like to do is make sure that we're seeing them. If patient's concerned, we'll see them out at the 18-month, and we just make sure we check in with our nail patients every year to make sure that they've not had a recurrence, that they're keeping up with proper foot hygiene, so that we can get out in front of it.
Well, that's great. I really appreciate it. I think you have some great tips. For those that are kind of on the fence of what type of treatment, do you have any resources maybe they should look at to help make that decision? Because I think that's a lot of times the problem. Most people know they have a problem, and like you said, they just put their head in the ground and they just ignore it.
Sure.
And any ideas or tips for people? Summertime, is that when people normally come in? Do they wait? Yeah. What are your thoughts?
Yeah, I think that's a great question. As far as the resource question, if you go to the Lunula website, I believe there's a link to the Middleton study. Dr. Middleton was one of the initial physicians in England who did the clinical trial. So there's a great 30-minute video. You can understand the format of the study and what he did, and shows lots of great photographs before and after. Dr. Zhang, Carrie Zhang, Z-A-N-G, wrote a wonderful paper in 2017 with Robert Sullivan that's available if you search, that goes into the efficacy and compares the Lunula as far as a very safe device and what their outcomes were. Those are 2 great references. Again, the Middleton study, which has got a YouTube video which you can watch, and then Carrie Zhang's paper was in the Journal of Clinical and Aesthetic Dermatology 2017. Those are really the handouts that we give to patients to be able to resource.
So on the bottom of this video, if people are watching it on YouTube, I'll put links to those articles so people can look them up. Well, great. Dr. Bromley, thank you so much for your time and your expertise talking about this topic.
Thank you so much for the invitation. I look forward to talking to you again.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.